you could either be in the same area. So if it's happening at school, then you go to the classroom, you go to the lunchroom. If it's at home, then you'd be at home. You could either be there in person or you could take video. However, I prefer being directly there. Because sometimes with video, well, it's only what the camera can see. Maybe something else is going on, outside of you that could be important. Okay, yeah.
Doesn't sometimes the presence of the person affect the behavior?
Yes, and we're going to talk about reactivity. Or did we already talk about reactivity? Maybe it's in this chapter. Yeah, so yes, it can, which is why you might not want to start taking data on that first day. You might first want to kind of get the kid familiar, with you, like introduce yourself or whatever, and that way they're just telling, okay, yeah, I know who that person is. And so you also don't want to be, if I'm taking data on her, I'm not going to be sitting up here with my clipboard like this and just staring at her, right? You want to be as inconspicuous as possible. So I might sit way back there. She doesn't know I'm here. She would never know that I was taking data on her if I was sitting back there. So different things like that we can do to reduce, reactivity. That's a good question. So yeah, must be in close proximity to the target behavior. Of course, you need to have a precise definition. So from your interviews and your FAST and everything that you collect with your indirect assessment, you should have a pretty good definition. Okay? So from that means that when I look at the definition and I'm starting to observe, let's say Corinne, I'm able to identify, right? If it's, let's say, she taps her pencil or whatever, right? Or bites her nails. That's pretty clear. So when she bites her nails, I'm going to record that. When she taps her pencil, I'm going to record that. Okay? So you have to have a clear definition. Okay?
Is there a specific reason people bite their nails? Like in your
I actually haven't had a client yet with that target behavior. Most of mine are, aggressive behavior, self-injury, trying to increase social skills, independent play.
Yeah.
I haven't had anything like that yet.
Every time that bite it all the way down to the like they don't have it now.
It could be different things. I mean, sometimes it's really just for what we call automatic positives. If they feel good, they just do it. Just like when people shake their legs, right? You do it to kind of calm yourself down, especially if you're bored in a class or you've been in class for 3 hours. You might start, shaking your leg or trying to keep yourself awake. Right? All right. So defining the target behavior. Kind of touched up on this. That is the first step, basically, defining a target behavior. Must identify exactly what the person says or does. That's very important. Okay. A good behavioral definition will include active verbs, and you should never use labels. So in your book, it has some good examples on page 20. So on page, sorry. Do you want me to talk to this? Okay. All right. Okay. So instead of just saying tantruming, right? Oh, Charlie tantrums all the time. Let's say you're in an interview and that's what Mom says. Well, you as a behavior analyst will know that that's not going to do as a behavioral definition. So you're going to try to dig deeper and get, specific action. So instead of saying tantruming, you would say when Bobby cries and sobs. So if someone's crying, you can see that, right? Because there's tears dripping down. And if he exhibits any one of these, I'm going to mark it. And that's all going to go under tantrum. Okay?
But that's depending on your definition, right?
Right. For him, for Bobby. Because if I were to ask, let's say, Charlie's parents, but their definition of tantruming for Charlie might be something different. Maybe for Charlie it's just crying and throwing himself to the floor.
So there's not like one exact operational definition.
No. Yeah. Exactly. Everything is unique to this person. It's not set. So it's not like the DSM, right? If they have this symptom, they have autism. Or if they have this, they have obsessive compulsive disorder. Nothing like that. This is all specific to the individual. Okay. What else? Okay, here's another one. So instead of just saying nail biting, anytime Mark's finger is in his mouth and his teeth are closed together on the fingernail, cuticle, or skin around the nail. Do you see how precise and detailed the definition has to be? So let's say I was observing Mark and he just had his finger in his mouth, but his mouth was open. Would I count that as nail biting? No. His teeth would have to be closed together on either the fingernail, the cuticle, or the skin around the nail. So maybe if he had this part in his mouth, would I consider that nail biting? No. So it has to be just this area. Okay? All right. So that's having a really good behavioral definition of your target behavior, which is extremely important.
Have you ever had a client that's unresponsive, like to questions, like when you've been in front of someone who doesn't respond, like when someone asks them?
No, because a lot of mine I can't ask them directly, so I ask the parents or teachers. Yeah. And I haven't had one so far that they answer my questions. Yeah. Because at that point, they need the help, and so they want their child, to succeed and to be able to function in their environment. So yeah, they've all been very helpful. Okay. So again, good behavioral definition is if after seeing the definition, not just you who created it, but other people who see the definition would be able to read it and would be able to observe that behavior. So you want to make sure that when you are collecting data, you will have what's called inter-observer reliability. And at the end, we're going to talk about how you would calculate that. But basically, this is when two people independently observe the same person, okay, and they both record that the behavior occurred. So let's say with that nail biting example, if, let's say, Tommy and Norma were both observers, but Tommy sat here and Norma sat up there, and they were observing Corinne here on nail biting, if they both independently scored that, yes, after each occurrence, right, she bit her nails 5 times, then you can say that your definition, you have a good behavioral definition, your data is reliable because they both, agreed that it occurred. and they weren't sitting together. They were separate. Yes.
So with that being said, is that the reason for the BCBA supervisors, or do they supervise all the time? Or?
No, so you just have to, yes, we supervise, but once we feel, once you've been trained on it, you've taken classes, you've practiced, taking data, then we don't always have to be there when you are taking the data, but what we would probably do is calculate the IOR. And there's a certain percentage, which I'm going to go into later, what it needs to be for it to be reliable.
Okay, well, that's what I meant. I thought maybe the supervisors would be the teachers or,
Oh, well, we would just we wouldn't have to actually take the data, but let's say they were my students, right, and they were taking data. I would have them turn it into me, and then I would calculate it, which I'll show you how to do. Okay, so when you are going to start to record your target behavior, there are certain things that you'll need. And the first one is the observer. You need someone to be able to go in and collect data. Okay, so that's the first question. Who's going to be the one observing and recording the behavior? Is it going to be the parents?
No.
Is it going to be, well, it could be. If you train them, it could be the parents. Sometimes it is the parents. Is it going to be a teacher? Is it going to be caretakers? Is it going to be your staff? Who is going to be the one? Okay. Now,
Professor
it
Neely,
doesn't have to be all the time. Yes.
but sometimes you don't feel, well, for example, we're like working at the elementary level for so many years, that some parents are very, very honest and they cooperate with when something, when we needed an observation, at home. But some parents really let you in.
Right.
So for example, maybe the child is very well behaved at home, or better behaved than in school, but some children act the same way, but yet the parent is in denial. So the parent will not tell the teacher everything that he hears.
Right. Which is where your direct observations will come in. So you might have, let's say, mom and dad take some data, right? But you yourself then are also going to go in because you need to figure out the function of your behavior. So you're also going to be doing your own data, but you might have parents do some, kind of pre-data things.
So you're rechecking, basically.
Yeah.
It's just like checks and balances.
Right. Yeah. You'll find it because and it will happen when you're doing your behavioral assessment, and let's say you're doing your interviews or the FATs, and they might actually sometimes you might even find the opposite, where they'll say, "Oh my gosh, they're always getting up from their chair and they're always doing this and doing that and doing that." Well, when you go, you don't see it, right? It doesn't happen. So it could also be the opposite, to where you go in and you don't see anything. But that's good. That's a good point. And then also, what else? Being in close proximity, they must be trained. Okay. And then the last one, do they have time to observe and record the behavior? This is important. So let's just say that you're going to take data on Tommy during his science class, okay? But the teacher has 20 plus students. Would the teacher be a good observer? No. Yeah, too many kids. So while she's busy, she's not going to have time to observe Tommy if she's got all these other kids to watch. So you want to make sure then, of course, you would not have the teacher take data. Maybe they have either a resource teacher who could also be in the room to just watch Tommy, or maybe they have, someone else that could do it, or then, of course, you would have to go in. need to be asked and answered for you to choose a reliable observer. And then self-monitoring can occur. So if you do have a client who, is able to comprehend or able to answer your questions, they can take data on their own behaviors, then, yeah, you would use self-monitoring. And this is only if, let's say, you can't find anyone else, right? There's no observer who can go at the scheduled time. That's good for the client. So, you could use self-monitoring. I mean, it is used. I've never done that, but I mean, it can be. Yeah. Did you have a question?
It was about that. Did you ever use that? And you said
No, I've never. No, I mean, like I said, I usually work with kids, so I just talk with the parents, and I just go in and observer. My students will go in and do the CPA.
Have you ever, do people, do BCBAs, do they also, help people with, a behavior that the person doesn't want to have anymore?
Yeah, I know, my supervisor was, at the time, was working with, weight loss, weight control. So,
So it's like a frequent
right. Mm-hmm. So it would be more working with, eating habits and working out regimens and how to stick to it. Yeah. So there's that. Or, cigarette smoking, too. Mm-hmm. Drinking. Let me...
When it becomes self-monitor, do you have to train them a specific way, or is it just?
Yeah, you would. Definitely. You would also give them the definition and say, so when this, and this happens, you give them either the data sheet or if they have also, what is it called, a counter, so they can every time they exhibit the behavior, they'll click one and click one. So have that, and then you would just kind of have a contract that, starting at this time, ending at this time, and then that way they can count the frequency.
Is the information trustworthy?
So there's also ways to check the reliability of the data as well. And that would be to, I guess, have somebody else also observe it, but only if they can. But you had...
Oh, I was going to ask, it depends on their mental capabilities, right? Do they have to have a certain grade level that they
Yeah,
read and write?
I mean, they have to be able to follow instructions, basically. Somebody else had a question? Okay, all right. So when and where? So I know what my target behavior is. I know who's going to observe and report the behavior. So where? Well, this information you are going to get from your behavioral interviews and from your FAST. That part where it said, where is the behavior most likely to occur? That's a good answer for us to start with, because let's say it only occurs in the morning at school. So you would look at a schedule and you would see, specifically what classes. Well, I would probably ask, okay, what's the schedule like in the morning? Okay, what classes does he have? Is there only a certain class where you've seen this behavior happen more frequently? And let's say, science class, right, happens from, 9 to 9:45. Okay. So if you know the behavior is most likely to occur between 9 to 9:45 during science class, would you go during lunch period? No. You're not going to waste your time because you're not going to see anything. So you would go from 9 to 9:45. That would be your observation period. Now there's two types of settings that you can collect data. You can collect data in the natural setting, which is best, right? Because it's where the behavior typically occurs. It's in their natural environment. So, for example, you would go to science class. That would be a natural setting, okay? Or a contrived setting. So that would be if you worked at a clinic and you actually took them into your clinic and maybe set it up as a classroom and were to see, what, if you saw any behaviors. That would be more of a contrived setting because it's not something in his natural environment. It's just something that you put together. You can also have structured and unstructured observations. You can do both. With unstructured, that would basically be if you were to come into the classroom and tell the teacher, okay, pretend I'm not here, just go on with your class as you would. If Tommy has a behavior, just do as you normally would on any other day. Handle it the way you would, right? You wouldn't tell her what to do. You would just watch her and see what she does. That would be unstructured. I like this one because I need to know. That's going to help me figure out the function. Maybe it happens that every time Tommy, gets up from his desk, well, that's when she gives him most attention. So maybe the function is, attention. Versus if I were to tell her to do something, my data would not be as reliable. But you could have structured observations where you would kind of test, right? You would test, you would manipulate the variables to help you get your function. So maybe for the first 10 minutes of class, you'll tell her if he engages in a behavior, do as you normally would. Then the next 10 minutes, okay, now I want you to, ignore the problem behavior, right? So he gets up, don't pay attention to him, see what happens. And then you'll say, okay, the next 10 minutes now when he does that, I want you to go up to him and talk to him and, redirect him and help him sit down. So that would be more structured, right? You're telling the person you're observing kind of what to do.
Professor.
Yes.
As far as the settings, is there a time or an event that would happen that a contrived setting would actually be better?
Yes.
Would that be during the actual?
It would depend on the behavior. And then the type of setting. So maybe it's a setting where, there's a lot of maybe kids around, there's too many distractions, too many things going on where you're not even able to clearly observe the child, then maybe you might do a contrived setting. But yeah, really, it depends on the target behavior. Yeah.
And
we really do want to do natural.
And can that, that would be for recording, but can the contrived setting be used to modify the behavior?
Oh yeah. As long as you make sure you generalize, which we'll be talking about. But yeah. Okay. So choosing a recording method. So we know what the target behavior is, we know who's going to record the behavior, and we know where. So how, right? How are we going to record the behavior? There's different ways. And the first way is through continuous recording. With continuous recording, let's say it was 9 to 9:45, and that's when you're going to go in, right? You're going to go in during science class and you're going to record 9 to 9:45. That's your observation period. So 45 minutes is your observational period. If I were to do continuous recording, then set my timer, 45 minutes, okay? Just observe, let's say observing Tommy. So anytime he engages in, aggressive behavior, I'm going to count that throughout the whole 45 minutes. I'm going to be there the whole 45 minutes observing him, and every time he engages in it, I will be taking, let's say, frequency. All this, you all have the definitions because we talked about it in chapter 1. But all this basically is saying is that with continuous recording, you can measure any dimension of behavior. So frequency, if that was important. If we're more important in looking at how many times the behavior occurs, then we would take frequency. If we're more concerned with the amount of time, so I don't know if I gave that example where, let's say it is tantruming in the classroom, but Tommy doesn't really tantrum that often, but when he does, he tantrums. It goes on for 30 minutes. That takes up a full class period. So we would be more concerned with the duration of the behavior rather than frequency. Okay? And then intensity, of course, the magnitude. And with intensity, typically with that, you'll use either some type of measuring tool or some type of rating scale. So like with self-injurious behavior, there's an actual rating scale and form that you can use that kind of helps you to identify, the intensity. So was there, a bruise? Was there an open wound? Was there blood? How severe was the injury? And then latency. So that's just when a demand is placed, from the time the demand is placed to the actual time that the person responds. How long was that? So, Tommy, go clean your room. You tell him that, and it takes him an hour. Okay, we want to shorten up that time to where Tommy, go clean your room. Boom, he gets up, he goes to his room, and he cleans it up. Okay, all right. This just kind of clarifies latency versus duration because a lot of people sometimes get confused. So make sure you don't get confused. With duration, we're just concentrated on the actual behavior. So when Tommy starts to tantrum, as soon as he starts crying, let's say that was one of them, right? Start your timer. All the way up, because maybe he's crying, then he's walking to the floor, then, until he finishes with his tantrum, then you stop. And that whole period was the duration of the behavior. Does that make sense to everybody? Yes? Okay. Now, if it's latency, so Tommy, go clean your room, start my timer, because a demand has been placed. Then, from the amount of time to where it takes, however long it takes him to actually get up and start cleaning his room, as soon as he gets up and goes into his room and starts, putting things away, you stop your timer.
So actually the action of him going on.
Right. The start of the behavior. As soon as he starts it, not completes it, but starts it, that's when he stops, because then that's the latency.
So then what if he has a tantrum?
You just continue. Latency. For latency, well, it's a different target behavior. For latency, okay. I think what you're trying to ask is, let's say you're measuring latency. What you told me.
It's like, how would you measure latency?
That's still latency. He's still not doing it. Yeah, until he actually goes to his room and starts cleaning, then you would stop it. So yeah, that's one thing. You would think it's simple, right? Oh yeah, just go. No. Some people could take an hour before they actually go and start the behavior. Yeah, if he's tantruming, he's still not doing it. So you're still going to keep the timer going. Yes.
So, with that being said, do you reinstate the demand? Do you reiterate?
Oh yeah, we're going to learn, depending on the function of the behavior, you'll know which application then to use. So, see, I can't say that just because it's a tantrum behavior, we're going to continue to place the demand. Because maybe that's not the function of the behavior. Maybe it's something else. So as soon as I knew it worked, but no. And that's something too. We'll talk with punishment. Punishment is yes, effective, right? It's effective immediately, but long term, is it effective? And that's what we'll talk about. Because then maybe next week, there he goes again, right? Oh yeah, I'll use the chocolate again. Effective immediately, but what's going to happen next week? Yeah. So we'll look into that. All right. Another way that we can record behavior: permanent product recording. This is if it is an indirect assessment method. So this is if, let's say, you're working on academic skills and you're trying to maybe increase, his grade in math class. Let's just say. So, okay, how do I measure that? Well, you probably use permanent products, because then with this, let's say it's increasing the amount of homework problems that he does. Because let's say you give him a sheet of 10 problems, and he doesn't even want to do any of them. So we need to increase that behavior. Okay? So would that behavior be a behavioral deficit or excess? Deficit. Yeah. Because it's not occurring. It's either occurring minimally or not at all, and we want to increase it. So yeah, it'd be a behavioral deficit. Okay. That was just a little quiz for you guys. So if we were to be using permanent product recording, then we would be measuring the number of homework problems he does, right? When he turns in his homework. Okay, how many did he do? Or how many did he get right? So this is indirect because we cannot. How do we know that he was the one that did the homework? Well, how do we know mom and dad didn't do the homework? Or brother did the homework? Or his best friend did his homework? So, although, yes, it is used, it is hard to determine whether it was actually that person's behavior, right? Were they the ones that actually answered the problem? Okay? So this is just another way to record behavior. Then,
So you're basically saying it could be unreliable data.
it could be. Because, yeah, you would have to be certain, and maybe you'll have to be there, right? Or have someone there observing him to make sure he does it. Then okay, we know he did it. But yeah, you have to make sure that you can control those other variables to make sure that it is reliable. Okay. Then you have interval recording. And interval recording is where, and I'm going to show you this. You have, let's say, the 45 minutes, right? Let's say the science class that we're going to go into, the whole time, the observational period is 45 minutes. But the target behavior occurs at a very high frequency. So where if you're doing continuous recording, where occurring every instant, you're going to miss one, right? For you to actually be taking data on every single behavior is going to be too much. So we would use interval recording. With interval recording, we're going to divide that observational period into smaller intervals. So we could do 5 minutes if we wanted to. Whatever you wanted. You could do a minute, you could do 2 minutes, whatever. So, okay. Let me show you 5-minute intervals. Okay? So now, I'm simply just going to, so I'm going to set my timer for 5 minutes. And if the behavior occurred anytime within that 5 minutes, it doesn't matter if it occurred 10 times, 1 time, 3 times, as long as it occurred, I will put a check mark. Or a plus, whatever you want. Okay? If, let's say then, okay, 5 minutes done. Set my timer again, 5 minutes. That's the next interval. If the behavior did not occur, then I'll put a minus. Didn't occur. 5 minutes, stop. Set it again, 5 minutes. You know, if it occurs at all within that 5 minutes, you put a check. That's interval recording. And that's if the behavior is occurring at high frequency. Because if not, like I said, it's gonna be a lot. Okay? All right. Yeah. So you're just recording the behavior as occurring or not occurring. That's it. And each interval. Time sampling. With this one, you're also going to take that observation time, so the 45 minutes, you're going to break it down, okay, into smaller intervals, whatever you want. And then you're going to pick a part of that 5 minutes. Let's say my intervals are going to be 5 minutes. So you're going to pick a part of that interval to start observing, whether it's at the beginning, whether it's at the end, whether it's in the middle. You pick a part of the interval to observe and see during the beginning of the 5 minutes. Let's say it's the beginning. You're only going to be concerned with the beginning. So once I started my timer, as soon as I started, let's say that first minute, did he engage in the behavior? Yes or no? And then you would just check yes or no. Does that make sense? This gets confusing with interval recording. Yes.
So if you pick the first part of the interval to observe, but he doesn't do it, but he does it in the last part, you still put no.
You still put no. Yep. And this is time sampling. So, observer does not have to record the behavior for the entire interval. It's just that little sample, wherever, like I said, beginning, middle, or end, wherever you want.
Is this used to figure out when it happens?
This is also if the behavior occurs at high levels. Yeah. Okay. And then choosing a recording instrument. There's so many different ways that we can record behavior. It doesn't have to be paper pencil. Now they have applications on your phone that you can use. You just download, and if a behavior occurs, you tap your screen. It's so easy. They have to where you can record frequency, duration. It'll have a stop, timer on there. iPads now. Everyone has that. So applications. You could use paper and pencil, data sheets, which I do like data sheets better. That's just
Because you have a hard copy, right?
Yeah. Well, no, it saves your data on your PD on the application.
Yeah, but wouldn't you remember it better if you're writing it down?
That's me.
Oh.
But every person, some people, right, are more, they like to work with technology, so that's great. They have all that stuff out there. But some people simply like to just write out the occurrence of the behavior. You can do that. What else do they have here? Yeah, hand stopwatch, handheld computers, a counter. Just so many different things that you can use to record behavior. Okay? And this is in your book, so you guys can look at that. Reactivity, we talked about. Someone brought it up. this is something that, yeah, you have to be aware of that it is out there. So don't think that, well, the teacher said, I'm in tantrums a lot, and I'm going in, and it's your first day observing, and I don't see anything. No, he doesn't need any treatment. Don't do that. Because it could be reactivity. So yeah, you're going to stay a little bit longer, maybe extend your days, and you'll see it. It'll occur. But anyway, yeah, so this is just something to be aware of. How to reduce reactivity. Like I said, if you have to maybe, introduce yourself, if it's a child or adult or whoever, kind of get them used to you a little bit, know who you are, then that's okay. And then have observer record behavior without the people knowing they are being observed. That's another way too. They don't really have to know who it is you're watching. A lot of times, even in classrooms, I remember when I was younger, I would always have somebody come in and I think they were evaluating the teacher. For all I know, they could have been observing a kid. I don't know. So that too. They don't have to know that you're observing them. Because by now you've already gotten, informed consent, so from parents or whoever. So you're good to go on that part. Okay, the last thing for chapter 2 is inter-observer reliability. There is a way to calculate whether your data is reliable, meaning was your behavioral definition, was it a good one? Okay. With what we call IOR, the higher the percentage of IOR, then the more, that means that your scoring was consistent, is reliable, yes, you can accept that data. But the lower the percentage, well, I wouldn't count that, right? Go do it again. Or maybe have or maybe the definition is not as clear. Then you would have to look at it to see, what's going on. You can accept IORs being at least 80%. I'm going to show you how to do the equations. If once you do the equations and it comes out to 80% or higher, then yes, you can accept the data. If it's less, no. Okay? So how do we calculate? If you are taking frequency data and let me write it out. This is for IOR, yeah.
So this is listed as IOA, it's the same thing, right?
Yeah. Because I think IOA agreeability, right? Yeah.
Maybe it's just analyzing attention. Because you do a lot of that on between 6 months and maybe, I guess, 4 months and a year.
I haven't had any that young. My youngest actually been 3. Because typically diagnosis doesn't come in until about 2.5. So, although, studies now are saying you can actually, when it comes to autism, see signs as early as 6 months. So, but I haven't personally worked with anyone younger than 3. Okay, so for example, with frequency, let's say that this is observer A, and this is her data. tally, that the behavior occurred 6 times. This is observer B's data. So in session 1, observer A counted 6 times, observer B counted 4. So this is frequency, right? Just how many times the behavior occurred. Okay. So we get the total. So we add up observer A's data, and we get 20. We add up observer B's, and we get 12. So to calculate IOR for frequency, you take the smaller frequency divided by the larger, and then you multiply by 100. So then what numbers would we take from here? 12 divided by 20, which is what?
I got it.
Okay.
0.6.
Yeah. So 0.6, and then we need a percentage, so we would just multiply by 100.
So 60%.
So 60% IOR. Okay, there. So can we accept it? No. Okay. So no, we can't accept it. Now for duration, it would simply be the same thing. You would take the smaller duration divided by the larger times 100. So let's just turn these numbers into seconds, right? So let's say the behavior occurred, 6 seconds for observer A, and then observer B counted 4 seconds. Okay? Same thing. You would just total the seconds for observer B, total the seconds for observer A. You take the smaller divided by the larger times 100. Yes.
Can we ask the observers to do it again, or would you rather have another?
No, yes, you can have them do it again, but then you would look at your definition. You would try to figure out why was it not consistent. So let's look at the data, and see. Maybe you would do some practice ones before, and then you can go in. Yeah, you can have them redo it again. The same people. That's fine. Now, if the same thing happens again and it's inconsistent, then okay, you might need to get some new observers. Okay. Now the only one that's different, so frequency and duration, pretty much the same calculation. For interval, remember, when we're taking interval data, we're just acknowledging whether the behavior occurred or didn't occur, right? We're not measuring how many times, we're not measuring how long the behavior occurred, just in those 5 minutes, did it occur? Yes or no, right? Next 5 minutes, yes or no. So for interval IOR, we're going to be checking the number of intervals with agreements divided by the total number of intervals in total. So, let me show you.
Number of individuals with agreement and total number of intervals.
I'm confused on the frequency and duration one.
Okay.
It's smaller frequency, like on the definition they have here, it's small frequency divided by larger frequency. But are you supposed to get like the biggest frequency for both like observers, or?
No, total. Total. So
it's always the total?
yes. So there. Okay. Yeah, it's from the total. Yeah. So you add them all up, and then you get a total. Yeah. And then so the larger from the total. Okay. Okay, so this then is our interval data. And this is for observer A, and this is for observer B. So the first 5 minutes, observer A said, yes, the behavior occurred. The minus is, right, no, the behavior didn't occur. Okay? Let's just say that this was their end result. So according to the definition on how to calculate, it says the number of intervals with agreements. So when you're looking at this table, how many intervals did the observers agree?
Three. So they both agreed, right? Okay, three.
Okay, so some say 3, some say 6. That's common. So this is what we're going to look at. Those of you that said 3, I think what you're doing is only looking at whether the behavior occurred, right? But it's whether they agreed. So it doesn't matter that they agreed that the behavior occurred, but also if it didn't occur, they agreed that it didn't occur. Right? So this one, they agree. This one, they agree. They did not. They agreed. They did not. They did not. They agreed. And they agreed. Agreed. So it's 6. So this is where it gets tricky. Make sure you don't just, right, look at it, oh, okay, because, yes, you probably will see something like this on your test. So make sure you know how to calculate IOR, okay? So it's the number of intervals with agreement, whether the behavior occurred or didn't. If they're both consistent, you're going to count it. So it's 6, right? So then, okay, 6. They agreed. They have 6 intervals with agreement. And then divided by the total number of intervals. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9. There's 10. So you divide. You get the answer. You multiply it times 100. You get 60%. Is this reliable? No. Ooh, these observers, right? No, you're not going to accept the data. Any questions so far? Do you all want to take a break? Okay, then that's my answer. Go ahead, we'll take a